hospitals are keeping tabs on masks for health providers right now.
Yeah, but should you bother wearing one to protect against the coronavirus?
That's a good question.
Medical reporter Liz Bonus is here to help answer that question. Liz.
Hey guys, good afternoon to you and to you. The short answer to that is if you are ill, wearing a surgical mask will protect someone else from getting those large respiratory droplets from contaminating others. That's why healthcare providers do need them sometimes. But right now, the Centers for Disease Control and Prevention says wearing one as an average healthy person walking around doesn't protect you from even the fine misting particles that are in the air that can make you sick from all kinds of things. There's concern the masks will sort of give you now a false sense of security if you're wearing one. Now they do need these masks, healthcare providers do, because there's been a run on them. A lot of people were asking, hey, you know, should we be buying them and are there going to be enough for healthcare providers? So I did a short survey today, asked most of the health systems in our area if they had enough of them. We got remarks back from several of them. Mercy Health told me today they boosted their inventory and they're monitoring the situation closely across their operation on a daily basis. From UC Health, we heard that they are not experiencing a shortage. In fact, they've proactively ordered extra protective supplies. And TriHealth tells us that they have more than enough of what they call the N95 masks. Those are what's recommended for healthcare providers for their team members. Hospitals do use these to protect when a patient is already deemed high risk. Here's what they also told us about the things they're looking at with infection control.
And so they're looking at all the typical good things you do with infection control, hand washing, wearing a mask, those type of things. And again, identifying patients up front that they're in a higher risk category to put them in isolation. And then those that go in and out of their rooms would wear protective clothing as well, and the masks and that type of stuff.
Now, part of the reason that these masks won't protect the average person is this is something we learned from SARS, and SARS was also a coronavirus. It's that it's transmitted more, they think, from touching contaminated surfaces, and that means like you touch a surface, you touch your own eyes and face and nose. Their point is that when you're putting on a mask, you're just putting your hands on your face to put that stuff on, and that's not necessarily a better way to keep from getting it. What do you think of that? Hey, guys.
Well, what I think is I want to cover myself in a bubble, and if you all need a mask, I have some at home.
Oh, no.
Why am I not shocked by that at all?
See, Erica just bought some. Yeah.
Well, okay, but in the NICU, there was a reason. Again, it's because you have an infected, you know, you're risking something you don't want to get to a little one there with big respiratory droplets. Paula, these will not protect you
What's
from
your reason for having the mask,
Well,
Paula?
actually, sometimes
False sense of
because at
security.
home vacuuming and working with
okay.
chemicals and things. But
Okay.
I have, in waiting rooms at doctor's offices, when there's flu going around and people look sick, I wait in the hallway.
Of course you
Woman
do.
does not play when it comes to germs.
So then
you all.
she gets sick from everyone walking by in the hallway.
Well, I try not to breathe when people walk by.